How to know you are immune to the hepatitis B virus. Part 1. The hepatitis B surface antibody test detects proteins that are made by the immune system called antibodies in response to the hepatitis B virus. Antibody test is used to find out if you are immune to the virus after natural exposure or vaccination. A positive or reactive result on the HBsAb test means you are immune to the hepatitis B virus. A negative or non-reactive result means you are not immune to the virus. This video explains about what is hepatitis B surface antibody test is for, when it is used, and how the test is done. This video is very useful for all hepatitis B patients. I would requested please watch this video till end. Why I need to do hepatitis B surface antibody test. The HBsAb test looks for the presence and quantity of HBV antibodies in your blood. The test shows how immune you are to the virus. How antibodies are programmed by your immune system. Antibodies are encoded by your immune system when your body is exposed to the HBV virus through blood or sexual contact, or if you are vaccinated with the hepatitis B vaccine. Can our body use antibodies to attack the virus? Yes, our body can use the antibodies to attack the virus if it appears again. It signals other parts of the immune system to attack and destroy the invaders. Who produced antibodies? Antibodies are produced by B cells in our body, a specialized white blood cell. When an antigen comes into contact with a B cell, it causes the B cell to divide and clone. These cloned or B cells or plasma cells release millions of antibodies into your bloodstream and lymph system. How many types of antibodies produced? There are 5 types of antibodies present in our body. Out of 2 are produced in response to the hepatitis B virus, names as 1. Immunoglobulin M, IgM, is the antibody that mounts the first attack against the virus but eventually fades away. 2. Immunoglobulin G, IG, is the antibody that provides long-lasting immune protection against HBV. The immunity can last for many years, but it gradually decreases over time. How antibodies help to cure from acute infection. The HBsAb test can check for a previous exposure to HBV and tell how recent it was. By comparing levels of IgM and IG, a healthcare provider can also use the test to monitor your recovery from an acute HBV infection. The HBsAb test can also show whether your vaccine protection is good enough. Your test can indicate whether you are successfully vaccinated, not successfully vaccinated, indeterminately vaccinated against hepatitis B. If you have acute infection, a booster vaccine might be needed if HBsAb level drops below protective levels. The HBsAb test is not the same as the hepatitis B surface antigen test or the hepatitis B core antibody test. These tests are used to determine if you have been infected with HBV. Who should get tested? A hepatitis B surface antibody test is recommended for Immunization Action Coalition, hepatitis B, infants born to people who may have hepatitis B, workers who are likely to be exposed to blood and body fluids, people on kidney dialysis, immunocompromised people, people who have a hepatitis B positive partner. If you like this video, please like and share this video more and more. Please support our channel. Thanks for watching Great Wisdom Discover. We will meet you with new update in the next video. Thanks for watching Health Wisdom.